Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mrs. Alavarki. May I know what brings you here today? Okay. Anything else? I'm very sorry to hear about it, Mrs. Alavarki, and I appreciate that you are concerned about your health. So, Mrs. Alavarki, at 45 years, okay, hemoglobin is low, MC is normal, ferritin is low, DIBC is increased, and transferidase is also increased. Okay, then I'll put a report in front of me instead of returning till the end of the consultation. Okay, so Mrs. Alavarki, I read your labs, and before I come to the management part, I would like to ask you a few questions to better understand your condition. Is it okay with you? Thanks for your cooperation, Mrs. Alavarki. So, Mrs. Alavarki, what promoted to have this report? Okay. All right. Okay, so what about your tongue? Okay. Okay, Mr. Alavarki, is there any blood loss in trauma or any blood loss in surgery? Okay. If you notice any bleeding from nose or mouth? Okay. Do you feel short of breath on mild exertion? Feel palpitation? Okay, and how about your diet, Mrs. Alavarki? Are you taking normal diet? How about your appetite? Okay. And how about your bowel habits, Mrs. Alavarki? Okay. Have you noticed any change in bowel habit after taking whole grain? Okay. Okay, Mrs. Alavarki, is there any, have you noticed any change in color of your stool, if it is black? Okay, if you are taking any iron supplement? No? Okay, is there any history of weight loss? You feel like your clothes are becoming loose? Okay, if there is any fever, sore throat? Okay, if you are taking any medication prescribed by doctor or over the counter, had any antibiotic recently? Okay, Mr. Alavarki, I'll ask you a few personal questions to better understand your condition, and whatever I will talk, I will remain between you and me. Okay, is everything clear till now? Okay, Mrs. Alavarki, so do you smoke? Okay, and do you drink alcohol? And do you have high blood pressure? High blood sugar? Okay, how about your sleep? Okay. What do you do for a living, Mrs. Alavarki? So how's everything at home? Okay, Mrs. Alavarki, and how about your periods? If they are regular? Okay. All right. If you had any blood transfusion recently or donated blood? Okay. If you had any past history of hospitalization? Okay. Any contact with TB patient? Any allergy to food, specific food? Any allergy to drug? Any drug allergies? Okay. Okay. Have you noticed any change in your voice? Hair fall? Okay. Okay, Mrs. Alaraki, I'd like to examine you to better understand. Is it okay with you? Thanks for your cooperation. Please come on the couch. I'll sanitize my hands and then I'll start from general physical examination. I'll check the general appearance of skin, if it is pale or not, if there is any jaundice. I'll check the pulse, if it is weak or fast, and then I'll ask patient to, Mrs. Alaraki, please look up for pale conjunctiva, and please look down to jaundice, and then I'll check nails, if there is any clubbing, koiloncure, spoon-shaped, and pale, and I'll and if there is any cyanosis or pulmonary edema. And then I'll check. Okay, Mrs. Alaraki, I'll check your neck from front and then from behind. Is it okay with you? Then I'll check thyroid. I'll inspect and palpate, and then I'll ask the patient to. Then I'll stand behind and I'll ask patient to swallow water, and then I'll feel if it is moving or not, and then I'll ask patient to I'll stand in front of patient. I'll ask patient to protrude her tongue, and then I'll briefly check auscultate heart at the aortic, pulmonary, tricuspid, and mitral area for any pansystolic or any added murmur or any added sound, and then I'll check edema, adhesions. Thanks for your cooperation, Mrs. Alaraki. And so the report I have read, and the signs and symptoms you have stated, I come to the conclusion that you are suffering from a condition what we call in a medical terminology is anemia. Okay. Okay, but I'll need two investigation addition to your iron profile if it is feasible for you. Okay, Mrs. Alaraki. So here is tissue transglutaminase, okay, Ig antibody, okay, and stool for occult blood, okay. And now let's talk about the management part. So first I'll talk about non-pharmacological, then pharmacological. Okay, so Mrs. Alaraki, I'll strongly encourage you to take food rich in iron, water series, curly kale, and dark green and leafy vegetables, and iron fortified cereals. Okay, and whole grains such as brown rice, bread, meat, liver, beans, nuts, apricot, and pulses. Okay, and I'll strongly advise you to eat or drink less tea, coffee, and milk and dairy products, and whole grain cereals. Okay, if it makes sense to you. Is everything clear till now? Okay, so Mrs. Alaraki, now come to the pharmacological management. So I'm prescribing you tablet ferrosulfate at 200 mg. Okay, you have to take it twice a day. Okay, and try taking with soon after food to decrease chance of side effects. Okay. Okay, and Mrs. Alaraki, this drug is not without side effect. Okay, it may cause constipation or turn stool black. Okay, and so you need not to be worried. Okay, and try to take more with it. Okay, and don't stop the medication. Okay. And I'm also offering you a tablet vitamin C 500 mg. You have to take it twice a day, okay? And it will enhance iron absorption, okay? And take plenty of citrus juice to increase the absorption of iron as well, okay? And I'll encourage you to please continue the treatment for 3 months, okay? And this treatment should raise your hemoglobin 1 gram per deciliter per week, okay? And I'll check your hemoglobin every 3 weeks after the start of treatment, okay? And then I'll see you after 1 month, okay? And then I'll offer a second follow-up visit every 3 months and for 1 year till your hemoglobin is just normal, then annually, okay? Is everything clear till now? Should I repeat it again for you? Okay. Okay, so Mrs. Laraki, is there anything else you'd like to share with me or ask today? Okay, Mrs. Alaraki, here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. Okay, I wish you a speedy recovery. Take good care of yourself. Bye-bye.